Welcome to HealthAide Chats. Today with Dr. Khurram Akhter. Khurram is the co-founder of HealthAide. He's a primary care doctor based in London, and he's been a doctor for over 20 years. He's worked in Australia and the UK, and as well as that, he's had experience integrating digital health into healthcare and preventative medicine. Khurram, thank you for speaking with us today.
Thank you for having me.
Thank you. Let's get started. I really want to ask a lot of GPs, this question really is, what are the most common conditions you see as a GP in the UK?
So I would say compared to Australia, our caseload is very similar. We see chronic diseases, often secondary to poor lifestyle in the form of type 2 diabetes, heart disease, malignancies, very typical of what we see in Western society, in the UK, in Australia, and most likely in the USA as well. I predominantly have worked in the metropolitan area, so in major cities, worked in London, worked in Melbourne, and you see that they are people who unfortunately have been eating poorly over numerous years, have not really been exercising, and these issues are a byproduct of that.
Yeah, so you kind of alluded that already, but what do you think are the biggest issues that's causing this kind of poor health among our society?
Absolutely. So as I said, it's people's dietary habits aren't as good as they should be. We've got a lot of evidence and a lot of science as to what we should be eating. We've also got a lot of evidence and a lot of science as to how we should be exercising, how we need to keep ourselves active. Unfortunately, on the back of 2 years of a global pandemic, most of us have been housebound and doing minimal levels of activity, minimal levels of exercise, and this is all having a big impact and will have a big impact on our lives in the next 5 to 10 years. I often think people are very well educated in knowing what needs to be done. It's just finding the motivation and the opportunity in their daily life to apply what they know. And I think this is the biggest challenge to a lot of people in society today.
Yeah, so it's really trying to understand, it's really the simple things that's going to make the biggest difference for people living with these conditions, isn't it? Like, for example, you alluded to probably eating healthy. It's really about like complex carbohydrates, lean proteins, healthy fats, lots of fruits and vegetables, things that people probably know to do, but it's easier said than done to really apply these principles consistently throughout their life, isn't it?
Absolutely. And I think really the first step is understanding what you should be eating and how you should be exercising. And I think that information is freely available anywhere on the internet for those who don't know, but it has been drummed into us through public health campaigns in the UK, in Australia. So it is generally common knowledge, but I appreciate some people may still not understand it. But the first thing to do is go out and get that knowledge and understand it. The biggest challenge is, as you said, is applying those principles to your life. Now, look, we have busy lives, but we do have pockets of time in our life where you can invest in your physical and mental health. And I often talk to people about this on a daily basis. I take myself as an example. So I take the train into work. It takes me 40 minutes to get into work. Up until recently, I would be sitting there just looking at rubbish on my phone. But after talking to my patients, I thought to myself, I need to practice what I preach. And I sat there and I started to think I need to do mindfulness for the 40 minutes that I'm on the train going into work. And it's just a 40-minute opportunity where otherwise I'd be doing absolutely nothing. Another silly example, which always makes my family laugh when I do that, but when I clean my teeth, I do squats, because otherwise I'd be standing in front of a mirror just brushing my teeth and doing absolutely nothing. So we've got to really think outside the box in terms of what our lives are like. We have busy lives, but we do have little points of opportunity whereby we can do a bit of exercise, do a bit of investment in our mental health. And when it comes to dietary stuff, it's about appreciating that, if you like the nicer things in life, it's just cutting back on having it all the time. And a principle that I often talk to people about is having a junk food Sunday, ideally once a month. Throughout the week, try and eat healthily. And then when you have your junk food Sunday, pig out, enjoy yourself. But by doing it only once a month, which is actually quite difficult to do, but doing it once a month, you drastically reduce your intake, but you still have a nice, you have the sensation that you're having some of the nice things in life. So it's just thinking laterally, thinking outside the box, and trying to apply those principles to your busy day.
I think I say the same thing from my experience as a physiotherapist to a lot of patients I see, is that you just have to start really small. Like if you can squeeze in if you're typically sitting all day for work, what about just finding an excuse to just stand up? Or maybe take your laptop to the kitchen bench, for example, and then do work there for 10 minutes. Or even you can just ditch the chair and then just go on like a kneeling position in front of your desk. Any sort of excuse to get you, from my perspective, moving a little bit more and doesn't take away from your productivity, that's going to add benefits in the long run if you accumulate that over time.
Absolutely. And I work in a preventative health clinic, and we've been tracking people for years who come to us regularly. And what we've seen over the past 2 years is a lot of people, their weight has literally just gone up like that, and their metrics are all declining. What we're seeing is people literally work, now that we're all doing the remote working or hybrid working, we wake up in the morning, we walk 10 feet to our desk, we sit down for 8 to 9 to 10 hours, and we walk a bit about the house and then go back to bed again. And this is having a huge impact on our health. And little steps, as you described, can go a long way in just chipping away at any issues that may have developed over the past couple of years.
Yeah, I think having that awareness is step one, and then giving simple strategies that are actionable. So then they can have options, and they can start introducing that within their lifestyle. And that's really key. That's kind of step one. So really, like, what's in terms of patients you see and you've experienced working in across different countries, across multiple health systems, what's your view on the health system as a whole? And, you know, what can be done better? What can we do better to really prevent these chronic conditions? Because it's still happening so much.
I think having worked in 2 healthcare systems, it's been really helpful to give you the insight into what works in a healthcare system and what doesn't work. Mm-hmm. Both Australia and the UK have issues in their healthcare systems, but comparatively, the healthcare system in the UK is poor for the patient and the doctor experience. I've spoken to friends, colleagues who are Australian expats, and they've recently, since lockdown has been opened up in Australia, been able to go back to Australia, and they've come back saying they've had a really positive healthcare experience with their GP. I have never heard of this in the UK. I rarely hear of somebody going to me and saying, I went to the GP and it was a great experience. There are inherent problems in the system, and it just takes a bit of research into looking at how the systems are run, what motivates individuals, the key stakeholders within the system, to try and improve the service that they're providing. I'll give an example. In Australia, we had a couple of times where the clinics weren't very busy for one reason or another, and the doctors were desperate to go out and see patients. They were thinking that we need to do a Facebook campaign to get patients in through the door. We need to raise awareness about this health condition, and there's a real motivation to try and educate people and to try and get them through the door and to try and get them the healthcare that they need. In the UK, you're looking at people putting hurdles in the way because they just can't cope with the workload that they're being presented with, and doctors are burning out incredibly, and patients are just not getting the care that they deserve. So it's a very difficult question to answer in terms of what can be done better, but I think it's going to take the medical industry to have a strong grown-up conversation about how we're running things in the UK, and do we as doctors want to be part of this, and can we continue to deliver this standard of care? Do we want to deliver this standard of care moving forward, or do you think that changes need to be made, inherent changes need to be made that needs to improve the way that patients can get care in the UK?
I think it really comes down to one thing I think about as a consumer in this population really is, how can I look after myself better rather than having to rely completely on the healthcare system? That's what I think. I think if we can find a way to really teach, the general public to really look after themselves, to do the things that can prevent illnesses from happening in the first place, then one, they're healthier, they're less likely needing to see us, and it places less burden on the healthcare system.
Absolutely. I totally agree with you. I think ultimately the healthcare systems in both countries are reactive. Where the healthcare systems wait for a problem to happen before we jump in and try and solve the problem. And, that it's in some circumstances it's working from that point of view. In some circumstances, certainly in the UK, it's not even working from that point of view. But you're absolutely right. Let's take a step back and talk about the preventative space and talk about, well, let's not allow the problem to happen in the first place. Let's do what we can do to keep ourselves as fit as possible, so we don't even have to deal with the healthcare system. And I think that mindset needs to be drummed in. There is a relatively new concept called Healthspan, which you don't hear in the public sector. You don't really hear government programs talking about this, but the concept is, how can I live longer but be healthier at the same time? There's no point being 90 years old if you're completely crippled and disabled and you can't enjoy your life. With Healthspan, what we're aiming for is for people to be 90 years old but still doing the things that they want to do, and doing it happily, and being physically and mentally capable of doing whatever they want to do. So absolutely, I think a lot more attention in the preventative space would offset a lot of pressure on the healthcare systems at the moment.
I think it's brilliant. I think really ultimately, it's a general statement, but I think everyone, wants to live a long and healthy life. I think that's what most people want. And a lot of times the actions are not in line with their goals. Not being healthy, not being able to do things that they love is really a source of the unhappiness that I see a lot in my patients. So yeah, you're right. If we can find a way for them to look after themselves a bit better, they'll be happier, place less burden on the healthcare system, and really just they can then live a long, healthy life and do what they want to do up into their elderlies. Yeah.
Absolutely. And I think the principle that I often work with in the preventative health sector is that I look at the guys who are performing at an extremely high level, physically, mentally. You look at your athletes, you look at your sportsmen, you look at your executives, you look at whoever is successful in their life, and you take their principles. And, whilst we may not be living our lives to that extreme, a lot of those principles are very transferable. And, a simple one I often give is, if you're into exercise, you look at a football player or a soccer player, and before they play a match, they warm up for a good 45 minutes before, they warm down for a good 45 minutes afterwards. Whilst I'm not going to be playing a game of football or a game of soccer to that level, I need to take those principles that when I go for my 5K run or a 10K run, I need to ensure that I warm up significantly. I need to ensure that I warm down significantly. But those principles are very transferable, and having a place where we can identify what the elite individuals are doing and what we can learn from them, all will, with that information, we can improve our health as much as possible. Bearing in mind that these guys have access to cutting edge science and cutting edge health professionals who are dealing, who their lives revolve around finding information, finding the research, finding the science that makes them healthier and fitter in the long term. And then what we want to do is learn from those people and apply it to our lives.
Yeah, I think that really leads us nicely to how can we then, deliver that sort of health education to the everyday folks? What can we do as clinicians? How can we really empower people to live healthier?
And I think that's a really good question. The current model of care is you come and see me. I work between 8 o'clock in the morning and 6 o'clock in the evening, and then outside of that time, you can't see me. Or if I'm working late, you can see me in my evening hours, but you won't be able to see me otherwise. And I think what we need to appreciate as healthcare professionals is that we have a lot to give to society. Now, after the pandemic, we as health professionals are burning out. We are exhausted. The workload is continuing to increase from the backlog of what hasn't been done in the past couple of years. And we can still try and stick to that face-to-face delivery of care, which I think we should do because that's what we trained up to do. But what we need to realize is, outside the clinic, we need to be the fountain of health information and of health knowledge. And how can we deliver that? Well, with the internet, we can scale our expertise online and make that information available 24/7 to people who need it. We can talk about the principles, not necessarily personalized care, but the principles how we want our patients to live by, and give them that information to look at in their own time, to learn from, and to apply to their lives, and keep your patients fitter and healthier. That doesn't always need to be a face-to-face conversation. And in all fairness, a lot of the time, when you're working in a normal clinic, you don't have time to have those conversations about preventative health, but you can post that information in a nice, safe place so people can read it. You can signpost your patients to that location. People can read it, understand it, apply it, and then you're going to get a better educated patient as a result of that. A lot of the time, patients are searching for health information on social media, on Google, and coming up with the wrong information from people who aren't qualified to talk about the information that they're talking about. So we also need a space where we can signpost people to and say, look, everyone on this website, on this site, is fully qualified to talk about what they should be talking about. I want to be speaking to somebody like you, but Will, I want to be hearing information from you about back pain. I don't want to be going onto Instagram and seeing some fitness enthusiast telling me about how to sort my back pain out, because why is he qualified to talk about that when I should be talking to a health professional? But accessing that health professional information is very hard sometimes.
Yeah, no, I totally agree. It is tricky. There's so much information overload at the moment. We don't really have a shortage of information, but we just need to be able to find the best one for us. And I think that's the hard bit. But I think with digital health, with having a platform that really curates the best information, that really makes that process a lot easier for people. If they can trust that place is the right one, then great. That's a reliable source that people can depend upon. Yeah.
Yeah, absolutely. And I think that's what we're trying to do at HealthAide. We're trying to create a place whereby everyone providing content on that platform is a verified health professional, but also the content that they're providing is evidence-based. It's the latest science. It's quality science that is being produced for the benefit of the individuals. You're absolutely right. We're going through a healthcare revolution at the moment, and the way we're accessing healthcare is changing. The pandemic has accelerated that. Before 2019, nobody was doing virtual consultations or telehealth. Now in the UK, the bulk of a lot of what GPs are seeing is through telehealth. We also need to think about how information is delivered, and I think that's where we fit in that HealthAide.
Yeah, I think that's a great note to leave on. Thank you so much, Khurram, for your time, and we'll have more of these chats later in the future. All right, brilliant. Thank you.
Brilliant. Thank you.